Hello everyone, good evening, and I'd just like to echo Cherry's points and just to say a very warm welcome from me, and to echo, I think, Cherry's remarks about the staff and our partners, but I'd also want to recognise some of our other partners as well that have been with us on the journey over the last few months as we try and make sense of the future for the organisation. So our patient representatives, our public and our local councillors. I'm going to take us through an overview of the last year, which ended at the end of March. I was only here for 3 months of that time, so I'll obviously take all the credit for everything that was good, and anything that wasn't quite so good, I'll lay it at somebody else's door. But I think we ought to just acknowledge that the hard work that Samantha Jones did in leading the team during the vast majority of the year that was 2010-11. And again, just in case you're wondering, I'm in my 27th year in the NHS. And I know, please spare my blushes, I can't possibly be that old. I look so young and fresh-faced, and Brian this evening mentioned, I don't know where he is in the audience, that I was still standing very straight and very tall, so everything must be okay, and that's his benchmark for how we're doing as an organisation if I continue to be standing upright. So let's hope I'm still standing upright by the end of the evening. So without any more nonsense, let's proceed with some of the highlights from last year. You'll know much of this already, I think. We deliver services from 3 main hospitals, Epsom, St Helier and Sutton. We also deliver services from a number of other sites, the Nelson, the Wilson, and also from West Park as well. So we have services in a number of different sites. We serve 420,000 people. We have 700,000 patient contacts every year. As you can see there, over 5,000 births, and that's rising. And I'm responsible with my team for 5,300 staff and volunteers. And we've recently changed the structure within the organisation to be delivering services through 5 clinical directorates. We're still a very busy organisation. This year to date, we're 3% busier than we were for the same period last year. So we're continuing to meet the healthcare demands of our local population, and those are rising every year. So what do we stand for? And as you can see on the left-hand side of the slide are the organisational values. And I sometimes reflect that they're a little bit abstract, and they're the kind of thing that you'd expect to see from an NHS organisation, putting the patient first, working as a team, and so on. The priorities on the right-hand side I'll focus on a little bit later in the presentation. But just reflecting on the values, I just wanted to tell you what that means to me. And I suppose in preparing for this evening, yesterday evening, I was at our Trust National Vocational Qualifications Awards ceremony, where 96 of our staff received awards for taking on extra training courses and doing that on top of their busy home lives and on top of full-time jobs for many of them. And one of the teams that I sat and talked to during the evening was a team that works in our operating theatres. And the conversation over the sort of 20 or so minutes really encapsulated for me the values of the organisation. They talk very much about how they strive to put the patient at the centre of everything they do, where they work very much as a team, both in terms of operating department staff, nurses and the surgeons, to try to make sure the patients get the best deal. And then we talked for about 10 or 15 minutes of that time about the way in which they would like to see the service improved and the ideas that they have. And for me, what my job as Chief Executive is to do is to enable them to continuously improve the work and the care that they give to patients. That's my job, and also my job is to enable them to be free to make some decisions and make some change themselves. So that for me is, I think, what our values are about. It's about our staff making sure that everything they do is patient focused and that we enable them to make change albeit within a constrained environment, particularly in terms of the finances. So in terms of the success during the year, as you can see, we met the vast majority of the government's key standards, including some of the high-profile ones around cancer patients and cancer waiting times and A&E waiting times. We had a year-end target of 3.3 million in surplus, which we met, and we met our financial obligations for the fourth year in a row. And we also, during last year, secured the £290 million worth of government funding specifically to redevelop the St Helier site. And over that period of time, whilst colleagues say to me, but Matthew, there aren't bulldozers yet on site and Ferguson House is still standing, I respond to them by saying, look, I'm not going to set bulldozers on Ferguson House until there's nobody in there, including patients and staff, and the process of decanting Ferguson House, re-providing services on the Sutton site and re-providing office accommodation and staff accommodation on the other parts of the site is not a straightforward process. But we're going as fast as we can. Those of you that are familiar with the project, perhaps from talking to Tim and Patrick next door, will know that we have some key milestones coming up where we empty out Ferguson House in a year or two, and then the bulldozers come in with an end date opening of April 2017. So the work continues, the funding is secure, our stakeholders continue to be absolutely committed to making sure that the inpatient facilities on the St Helier site are redeveloped. And I'll come back to the transaction process later on in the talk. We've continued to have good feedback from our patients. 87% of our patients have rated their care during the Care Quality Commission's review as good or excellent. Again, on cleanliness, our scores have been very positive. 94% of people in the review that was done considered their room to be and the ward to be very or fairly clean. So we had a number of areas where we were rated highly. As ever, with any NHS organisation, there is always room for improvement. You'll also see there we've invested significant amounts of funds to improve the services that we provide. We've highlighted here two, which are around stroke care, to ensure that we're meeting both the London stroke care expectations, but also the Surrey service expectations, which are different, but are equally focused on ensuring stroke patients get the best possible deal. And we've also this year invested a significant amount of money in improving the way in which patients that come in through our A&E department are looked after, so that they have a senior doctor reviewing their care as early as possible in the process. We've also recently opened new dialysis units within our regional renal service in Purley and in Epsom. And in terms of our Care Quality Commission review of our staff, for many of the indicators we're placed in the top 20% of trusts in England, and our staff, and again paying tribute to them, because our staff are working in a very difficult period of uncertainty. They are saying that they feel satisfied with the quality of work that they're able to do, the level of patient care that they're able to do, and they're also reporting feeling motivated and feeling that actually the organisation is trying to look after them with flexible working options and making sure that they are communicated well with. And at the moment, from my perspective, that's absolutely key to make sure that the rumours and the ill-informed opinion that is about both around Epsom and St Helier is addressed, and the facts are shared with our staff so that they don't become too anxious about what the future might hold. We continue to cut our infection rates. MRSA rates down by 35% and C. diff down by 21%. As I said, our PEAT scores, which are the independent review of our cleaning standards and hotel catering standards, were rated good and excellent. So good on the St Helier site and excellent on the Epsom site. We won the prestigious award from UNICEF for promoting breastfeeding, so the International Baby Friendly Award, and we've also unveiled some important patient-centred facilities including the maternity assessment unit on this site and the Cancer Information and Support Centre at St Helier. The specific investments, as you can see listed there, I won't read them all out, but you can see we've continued, despite organisational uncertainty going forward, we've continued to invest in improving patient services. I also want to recognise that not all of the money can go directly into patient frontline services, because we do have ageing building stock that we need to make sure has a roof that doesn't leak, building generators that work on and are energy efficient. So with the help of our estates team, we make sure that we prioritise enough money to make sure that our buildings are fit for purpose, as well as patient-focused investments. And then this year, again, looking to invest £9.6 million across both sites. We soon, I hope, will open our new day surgery unit on this site, which will really make us very much focused on the privacy and dignity agenda through our day surgery facilities. And you can see there some of the other fantastic investments that have come on stream so far this year. And broadly, the money is split 50-50 between Epsom and St Helier, and much of the new development work that we will be doing from the funding associated with the new hospital development is also focused on the Sutton site to ensure that that is fit for purpose for running services as we empty Ferguson House. Some sea of green, almost. You can see, despite us reducing significantly our infection control and infection rates in the hospital, we didn't last year meet the MRSA bacteremia target, which was to have a maximum of 7 cases. We came in at 11 on the year end, but you can see across the rest of those indicators around access to genitourinary clinic times, cancelled operations and A&E target we met successfully. And indeed, 18 weeks, so the referral to treatment time from GP referral into our hospitals also was extremely strong during last year, and continues this year to be absolutely strong and rock solid, and many of our trusts locally are struggling with this indicator, and I'm confident that we'll continue to have a strong performance in relation to waiting times as an organisation.